right, well, we'll go ahead and get started. Hi, everyone. Thank you for joining us tonight for our 2021, our first ever virtual week on the Hill, presented by the Kentucky chapter of the American Foundation for Suicide Prevention, the Kentucky Suicide Prevention Group, and the Suicide Prevention Consortium of Kentucky. Joining me tonight are representatives from each group, as well as Representative Willner. And we also have our special moderator, Marcy Timmerman from Mental Health America. She's part of the Suicide Prevention Consortium, and she'll be monitoring the chat and the question and answer box throughout. So feel free to leave any questions in the chat box. So these are our speakers this evening. We'll be going over an introduction to suicide prevention in Kentucky, some suicide facts and figures, Advocacy 101, Kentucky policy priorities and what we're asking you to take to the Hill this week, how you can take action, and then have some additional time for questions and answers. So my name is Megan Cole. I'm the Kentucky Area Director for the American Foundation for Suicide Prevention. After I lost my Aunt Linda to suicide in 2014, I was introduced to the American Foundation for Suicide Prevention and Out of the Darkness walks. AFSP works to provide much needed research on suicide and then allows that research to fuel prevention education programs, loss and healing programs, and advocacy efforts on a local, state, and federal level. I quickly discovered that being actively involved in the fight to stop suicide actually helped me find my healing. And so I wanted to get more involved. And that's when I was invited to AFSP's National Advocacy Forum in DC, where I discovered the powerful advocate that I could be just by sharing my story and that of my aunts. And that's what I'm hoping to teach you today and this week. I've been very excited to get involved with the Kentucky Suicide Prevention Group and the Suicide Prevention Consortium of Kentucky these last couple of years, as they have been strong advocates for various suicide prevention legislature for many years in Kentucky. And last year together, we were able to get both bills that we advocated for signed into law. And I'm thrilled to see what we're able to continue to do across the Bluegrass this year and for years to come. So with that, I introduce you to Steve Ulrich.
Hi, everyone, and good evening. And I'm Stephen Ulrich. I'm the president of Kentucky Suicide Prevention Group. And just to give you, a lot of times it's good to go backwards and look at where you've come from. I love boating, and when you get out in the ocean, the landscape doesn't change, and you don't know where you've been or where you're going or how far you've come. And I got thinking about that today. How far have we come? In 1999, just 22 years ago, Dr. David Stacher was the first Surgeon General that came out and said, here's what we've got to do. We've got an issue with suicide, and it's a mental health problem, and we've got a crisis in the United States of America. And the next year, he put out what his initiative is how are we going to do this? How are we going to stop suicide? And a lot of what his thinking is that advocating, how do we educate people? How do we educate teachers, coaches, all of the other folks? And so he put that national strategy out in 2000. In 2002, there was a conference down in New Orleans, and a group of people from behavioral health here in Kentucky went to that conference. And at that conference, there's a guy by the name of Kevin Hines. If you know anything about suicide prevention, you've probably seen Kevin. Kevin is one of the few people that survived jumping off the Golden Gate Bridge. And he told his story. Those folks there came back to Kentucky and said, we've got to do something. We've got to begin doing something about suicide prevention or suicides in the state of Kentucky. And they started putting together a group. The person that led that was a lady by the name of Barbara Kaminer. Well, for my wife and I in 2002, we had no plans on ever joining KSPG or anything else suicide prevention wise, because we were on top of the world. Our son, Nathan, was playing basketball for Western Kentucky University. He was a sophomore, second-year walk-on. We thought life was good. The only thing is, he had injured a foot and he was not able to play all that year. At the end of the season, they had gone to the NCAA. We thought life was great. And on June 8th, we get a phone call. And it's his biological father calling us in Louisville, that asking us if we had seen Nathan. And we said no. And wow, what's up? And he said, well, you're not aware of this, but Nathan was released from the team just 6 weeks ago. And that floored us because Nathan had come to our house. We had a birthday party for him. It was a Western Kentucky theme. It was, everything was great. We thought. I was telling him how great the team was going to be next year. And little did I know that he was no longer on that team. Well, they called back later on that evening, and Nathan had died by suicide in his dorm room. A few days later, we were going to the funeral home, and my father-in-law kept telling me, hey, I found this stuff from David Satcher, and he's got this initiative about suicide prevention. And did you know that suicide is the second leading cause of death on a college campus? Did you know the second leading cause of death in a high school is suicide? And it was like, Jim, I can't do this. We can't do it. A few weeks after that, we had heard about a group forming in Frankfort, the Kentucky Suicide Prevention Group. And my wife and I knew we needed to join it. And we had called and got connected with Barbara Kaminer, and we became part of the Kentucky Suicide Prevention Group as it was forming. We also got involved with a group called SPAM, much like what Megan just said, going to Washington. They had a big get together in Washington and advocating. We didn't know anything about advocating. Not a thing. The only thing we knew is we had our story. For each one of us that have lost somebody to suicide, and as we look at advocating, what you have is your story. And we were told more than likely you won't see a congressman or a senator, you only see an aide. But they were wrong. When we went into Mitch McConnell's office, we indeed saw an aide, and they took us to a conference room, and through the back door, Mitch McConnell came in, and he wanted to hear our story, and he listened, and he promised us he would do everything he can to help in suicide prevention. A couple of years later, the Garrett Lee Smith Act happened, and that was funding for suicide prevention across the country. And he helped get that through, along with a lot of legislators, a lot of people. It didn't know politics, because every one of them also knew somebody that had died by suicide or had been affected by suicide. Well, at the Kentucky Suicide Prevention Group, we got together, we used that money. We ended up the state of Kentucky doing great stuff with training, QPR, question, persuade, refer. We did wonderful with that, but we had one problem. We didn't have any money. So in 2008, guess what we did? We started Day on the Hill. And why we started Day on the Hill? Because we're going to go talk to our legislators, and we're going to tell them what we need, and they're going to write us a check for money and all this other stuff. And you just go in there and go, hi, Senator Zan Syme was that my senator at that, and we're here, and this is what we're doing. And could you write us a check for maybe $100,000? It doesn't work that way. There's a whole process. There's a whole thing that happened, but we learned from that. And we started learning from that day. And in 2009, we also learned as a KSPG, we needed to go and be our own thing, a not-for-profit, and not being under the arm of the Kentucky Mental Health Department. So anyhow, in 2010, as we went to the Hill, we thought about Dr. Satcher and what he said a year, almost 10 years earlier. Can we train teachers? Can we train other people in suicide prevention? And we wrote 2 bills that year. One aimed at training teachers in high schools and in middle schools, as well as all that staff. And the other was getting information out to the kids. When we wrote that, people told us there's no way you're going to get those bills through. It's not going to happen. There's just too much going on. It's a financial year. It's not going to happen. Well, let me tell you, we got them through. In fact, the one for the teachers, both houses were almost unanimous. There was one no vote. And the one no vote, the person said, I want it on record. The reason why I'm voting no is because I think it needs to be in the elementary school. The love and support from our legislators is huge, because so many of them, they're just mom and dads. They're just sisters, brothers, and the only way they know is from our story and understanding. That's why tonight is so important, getting people to help tell our story, tell your story to the legislators. In 2013, we were able to get another bill through, that continuing education for counselors, for other people, because what we're finding is that there's not been a lot of work in suicide prevention. There's not been a lot of things, mental health has been that taboo subject, we don't talk about it. Today, we talk about it. In 2020, as we spring forward, KSPG continues to do wonderful things. We still sponsor a lot of training. In fact, this past spring, when COVID hit, we got a call from one of the crisis centers through behavioral health, and they said, look, we got people that want to work, but we don't have any computers and we don't have the funding. So we were able to take the money's been donated and give that back to the crisis center. So those people today are working at home. When I reflect back and think about some of the stuff we've done, and every time I think about it, there's always somebody that comes back and says, the work that all of you people are doing, AFSP, SPOC, all of us, AFSP, you're saving lives. And that's what we're doing. And hopefully one day, maybe, through KSPG, we'll get some more people, because I'm really proud of Megan and having her with us, because that's AFSP. What that work has done has been giving us Megan and another full-time person. And my goal and hopes and dreams is that we'll get another full-time person in suicide prevention. So enough from me. Come join us. Thank you for being here. Talk to your legislators, because if you don't, they don't know. They're just a mom. They're just a dad. They're just a friend, and they're easy to talk to. Back to you, Megan.
Thank you so much, Steve. And last, we're going to hear from Stephanie Benson, who's the chair of the Suicide Prevention Consortium of Kentucky.
Well, good evening. I bring you greetings from the Suicide Prevention Consortium of Kentucky. And this it's really tough to come behind Steve. And actually, I stand on Jan and Steve's shoulders. That was my beginning to become active in suicide prevention when the consortium was forming and we were mobilizing communities across the state. And I'm very proud to serve as the chair and to promote the awareness and prevention of suicide through education, through our annual community forums. We've addressed veterans issues. We've addressed community concerns, and we continue to be a resource for individuals and organizations. We've also been active on Day on the Hill for the last few years, and we're pretty soon to start our Lunch and Learn series, where we're going to be talking more about QPR, the question, persuade, and refer, and other issues that maybe plague our community. We're also partnering soon with Faith-Based to promote and heighten the word of suicide amongst that population. So I'm very proud and honored to be with you all this evening. And thank you so much for having me. And I just look forward to working with you all.
Thank you so much, Stephanie. I'm always thrilled to work with you and Steve. And now we're going to hear from Representative Lisa Willner. We're so excited that she was able to join us tonight, and she's actually introducing one of the bills that we'll be advocating for this week. So if you have any questions for her, she's here to answer, but she's also here to talk about the importance of advocacy and the power your voice can have, like Steve was saying.
Thank you guys so much for having me. This is great to be with this group. I'm from here in Jefferson County, in the sort of central part of Jefferson County in Louisville, as the district that I represent. I am the one and only licensed mental health professional in the legislature. I'm a psychologist. And a lot of the work that I do, the legislation, the policies that I'm interested in, have to do with mitigating trauma. So when I was asked to come and speak with this group, of course, you guys are very close to my heart, and this work that you guys are doing is so important. And so I could not turn down this invitation, and I'm really happy to be here with you guys tonight. I did mention to Megan, I'm much more of a sort of dialogue than in person than a speech giver. So I'll talk to you a little bit about a bill that I'm working on, but I'll open it up to any of the panelists if you want to stop and ask me questions as we go. I'm very, very open to that. So one of the bills that I am sponsoring this session, and this is actually my third session to serve in the legislature, and it is my third session to be the primary sponsor of the House bill to ban the dangerous and deadly practice of conversion therapy. Conversion therapy, it's a terrible name for it because therapy is something that helps people, right? Whether it's speech therapy or physical therapy or mental health therapy, it's to help. And what conversion therapy does, it's a sort of blanket term for any treatment that seeks to change an individual's sexual orientation or gender identity. And what we know from decades, 30 years or more of peer-reviewed research is that, first of all, it doesn't work. And second of all, it is extremely dangerous. So this is House Bill 19. I will share with you data that LGBTQ kids who have been exposed to these types of treatments to change their sexual orientation or gender identity for lesbian, gay, and bisexual kids, increase in suicide, well, huge rates of suicide attempts, 42% is what some studies have shown. So 42% of young people exposed to these treatments have a suicide attempt within a year of that treatment. And that does not account for numbers of actual completed suicides, which is daunting. So, people feel all kinds of ways about LGBTQ issues. This really, we could talk about that another time, and I'm happy to have those conversations as well. But this is such a high risk population. Something like 75% of homeless youth are actually in the LGBTQ population, and that's because so many LGBTQ kids are actually turned out of their homes. Kids in foster care then are often subjected to these dangerous treatments, and that's enormously problematic. These are kids who've already experienced trauma. They have been, in many cases, removed from their own home. They've lost their support system. They've lost the support many times of their religious community, and they're turned out. They go into a new home, and then they are sent for these dangerous practices to change who they fundamentally are as human beings. So this is our third year on the bill. Since I've been in the legislature, we've changed the bill a little bit every time to try to make it a better and better and better bill. I'm very, very, very pleased with the progress we've made in terms of growing the bipartisan support. Suicide is not a partisan issue. Health and wellness, well-being, mental health, none of these are partisan issues, but so many times bills become divisive and framed as divisive kinds of issues. So I'm really happy that in the House, we have bipartisan co-sponsorship for the very, very first time this year. I am a Democrat, as I said, a psychologist. I'm an educator as well. I taught in the psychology department at Bellarmine for many years. My primary co-sponsor is Kim Banta, also an educator. Kim is a retired high school principal and had worked as a teacher. And she's seen firsthand, she's seen the effect of kids who are bullied because of who they fundamentally are. She has seen the rejection, the depression, the substance use, the withdrawal from friendships, from relationships, that sense of not having a place where they fit in, where they belong at school. And once they're exposed to these practices, all of those risks go through the roof. So this bill, House Bill 19, would do three things. The first thing it would do, unfortunately, legislation is not magic. We can't, policies have limitations. And as much as we would like to wholesale ban this practice, there are limits to what the legislature can do. So what this bill would do would be to prevent, licensed professionals, those holding a license to practice a health or mental health profession, from engaging in these practices. And, if the state of Kentucky is going to grant someone a license to practice, there should be some assurance that that licensed professional is engaging in practices that are safe. So that is the first thing. It would prevent licensed professionals from engaging in these practices with minors. The second thing that the bill would do would be to prevent any agency that engages in these practices or refers for these practices from getting any state dollars. So if you're a foster care agency who refers children, young people, adolescents to conversion, so-called therapy, I'll use my air quotes there, you do not get state funding. You could not get state funding under the terms of this bill. And then the third thing it does is it would require or ask of the Department the Cabinet for Health and Family Services to create educational materials about the dangers and the risks and the ineffectiveness of conversion therapy, and to distribute those materials widely to all kinds of agencies that work with youth, schools, sports clubs, any kinds of activities, any places, health providers for certain, any place that serves young people would receive these materials. So those are the three things that the bill would do. This is the third year I've been carrying it. We've picked up additional co-sponsors every year. We have the support of every mental health association in the state. The Medical Association, Nursing Association are on board. There's a huge group of medical students from both U of L and UK who are supporting this. Your wonderful organization is supporting this legislation. We've got education groups across the board. So that's what the bill does. And let me just, I'm going to segue clumsily. I'm going to segue clumsily to just talk about advocacy. And I appreciate so much what Steve and what Stephanie and what Megan were saying. As legislators, this session, in any given session, I'll be asked to vote on budgets, on duck hunting, on what can be planted where and in what conditions, agricultural issues and banking and insurance issues, you name it, every issue that can come up as a legislator, I'll be asked to vote on those. I'm a psychologist, I'm not a farmer, I'm an educator, I'm not an expert in banking and insurance. And so you guys think that you need legislators, but the truth is that the legislators need advocates. We need trusted people, people we develop relationships with, who are willing to tell their stories, who are willing to share their experiences. We had testimony during the interim this past summer on the conversion therapy ban. And one of the people who came and spoke was a young man who was subjected to conversion therapy when he was a teenager. He's now in his late 20s. And he spoke about his experience. He talked about his suicidal thoughts that he had as a result of that. He talked about the damage that he, more than a decade later, is continuing to contend with. And it's those stories. It's having people talk to legislators one-on-one, in groups, over Zoom these days, to come to the table and to testify when legislation is heard. It is powerful. I tell people, my expertise is in a few things, but we're asked to vote on everything. I have to go outside my own head, my own experiences, my own education, to be informed about bills. And so I want to really lift that up. I want to say how grateful I am to all of you who are on this call, interested in advocacy. It's so important. So many people say, I'm just not that interested in politics. But the thing is, policy affects every single aspect of our lives. And so not being interested in politics is given the reins over to people who are going to be making decisions, with or without you, and better with you, right? Better to make those decisions with you at the table.
Thank you so much for talking some about conversion therapy bans and advocacy. I did want to ask, do you have any tips for people who might be new to advocacy going into meetings with their representatives? What advice would you give them?
Yeah, I think do your homework. Do your homework. I will occasionally get really angry emails from people. Why doesn't Kentucky do this, this, and this? And why do we allow conversion therapy? Literally, I will get emails like this. It's disgusting that we allow this in this state. And what's wrong with you people, that you allow this? And come on, just do a little bit of reading. And, I also get emails from people who are upset because I don't support an issue they're interested in, and they've done that research as well. And I can explain to them my position. We can have a conversation. Sometimes they convince me, sometimes I convince them. Sometimes we just, have to agree to disagree. That happens as well. But try to know a little bit about what your legislator stands for. If they're already a co-sponsor on a bill that you're supporting, go in thanking them for that instead of, ready for an argument. And then the other thing, I would say what Steve was saying is so true. We're moms, we're dads, we're daughters, we have jobs. We're regular folks, and the Kentucky legislature is that way by design. It's a part-time legislature. We are, citizen legislators with lots of different irons in the fire in many cases. And so, approach us the same way you would approach any other human being, right? So there's no need to be scared of us. There's no need to bully us, right? There's just remember that we're human beings also.
I've got a question or thought that what you were talking about, because you're talking about mental health, and we're on a new frontier on mental health. And when you were talking about the conversion, I'm sitting there thinking and going, when I get a drug prescription, they have to put on there and tell me that I'm at risk for suicide. This drug does this, it does everything else. Is there a form or anything that is given to a parent when they bring that child in that sits there and says that this child will come out of here at a higher risk? We know they're at a higher risk for suicide after the fact, because we know that when they go into hospitals, so, you come out on the other side, you're at a higher risk. Is there anything that alerts parents to that?
There is absolutely no informed consent. It is, entirely unregulated. There's nothing in statute currently that addresses the issue at all. So, and that's such a good point too, because if a parent or a caregiver brings a young person for conversion therapy, that person, that parent, that caregiver, they genuinely want what's best for their kid. They're not thinking, okay, I'm going to subject you to this torture so that you're going to be at risk for suicide and depression and drug use and social isolation. Nobody thinks that going in, right? And so as I've talked with conversion therapy survivors more and more, I have developed, strangely, it's like I've developed more and more compassion for the parents who send their kids. And there's so much misinformation, disinformation, inaccurate information about what's out there, and there is absolutely no informed consent.
Here's where I see that you could help us right now, because as I was saying earlier, our stories are what we have. And, I can tell Nathan's story, but what I'm recognizing right now is you have your story. You understand why this is so important. So if you would just take a moment, as though you're meeting with me, your representative, and helping me to understand what's going on. Ms. Willner, welcome to my office. I'm here. It's so good to see you. I'm glad you came by. And by the way, thank you for voting for me. It's good to see you.
Absolutely. I had your sign in my yard. I was happy to support you.
That's the one they kept stealing, wasn't it? I think I gave it to you about 10 times.
That's right. That's right. But I'm here, Representative Ulrich. Thank you for seeing me, and it is good to see you again. And we're neighbors. You represent my district, and so I'll just a quick aside from the role playing, to establish those contacts early on. Remind what neighborhood you live in. What your favorite restaurant is, or where you ran into your representative when you were both out getting ice cream last summer with your masks on, standing 6 feet apart in line, right? So make those connections. But then you want to get to it. And so Representative Ulrich, am I pronouncing your name correctly? Yes. Okay. I'm a psychologist. I'm a licensed psychologist, and I'm deeply concerned that we have members of our profession and of other helping professions, health provider professions, that are engaging in a really dangerous practice called conversion therapy. And it's a practice that tries to change a person's sexual orientation or their gender identity. And what we know is that these practices don't work. And I have spoken to so many young people who have survived this practice. And it's heartbreaking. The shame that they experienced, the message that they got at a really vulnerable age. We're talking about 12, 13, 14-year-old kids who are at a stage in their emotional, social development where they're figuring out their identity, they're figuring who they are, and they're being told by the people who love them the most and by a licensed professional that who they are is not acceptable and they need to be someone else. And too often that results in suicide. When it stops short of that, it still very often results in substance abuse, self-harm, social isolation, anxiety, depression. The list goes on and on. These are very, very real, life-threatening risks that's being posed by this practice. Did you know that currently there's nothing in the law to say that practitioners cannot engage in this?
No, I didn't know that.
So it's discredited. Many states have banned it already. And if I were really here advocating, I would have done my homework and I'd tell you exactly how many states have already banned it. But it's a bunch, including some red states. So these are not just, so-called liberal states that have passed this. This really is a mental health protection that we're needing here in Kentucky. Too many kids are at risk. I've personally spoken with kids. I've spoken with parents who subjected their kids, their beloved children, to these practices, not even knowing that it was dangerous, not even understanding, thinking that they were going to help their kid, and not knowing how discredited and dangerous these practices were. So there's a bill out there. I hope you'll read it. I hope you'll consider being a co-sponsor of the bill. You've got my cell number, and I have yours because as an advocate, you always want to have your legislator's cell phone number, right? So please read over the bill, text me, call me if you have any questions. I would love to chat with you more about this, and I would love for you to get on board and protect young Kentuckians from this really horrible, horrible practice.
Miss Willner, I'm so glad you stopped by my office. And this hits home. I was talking to my sister the other night, and her son's struggling, right where what you were talking about. I say I don't know anything about it. I played football, you know. I mean, I'm an old jock, and I just told her what I know. Hey, he'll snap out of it. He's young. He'll snap out of it. But what I just learned from you, it's not just snapping out of it. He's struggling. He is struggling. He needs somebody that can help him. And what you're telling me, some of these people, this is going to put him at even a higher risk than where he's at right now.
Right.
So yes, I'm happy to sign on this bill. Yes, ma'am. I'll read. Yes, because you're saving people, you're helping people, and that's what I'm all about. I mean, that's what the pastor keeps telling me. And you and I sit in church. We can't sit close anymore, but you know, I wave you to you on the other side, but I know you don't recognize me, you know. Busy lives.
I'm glad to see you wearing your mask when you're there.
Absolutely. But I think, again, what we just went through, I think that helps people understand how a legislator, somebody that's in there, and it might, you know, somebody might push back on you a little bit that says, hey, I don't buy any of this or whatever. But like what you just did, that presentation was perfect because you weren't combative. You just told your story and you made it personal, you know, and that was wonderful. Thank you.
Thank you for the opportunity. I didn't know I was going to get to do some acting tonight. So,
well, I didn't either, but when I started thinking about what you were talking about, what we're talking about, and you know, because we've got a lot of people out here that the first time going in, it's nerve-wracking.
absolutely, absolutely. And you know, I've been advocating for a long time, and in fact, I used to take kids from my church to meet with their legislators on some environmental issues that they were really concerned about. And I was more nervous than the kids were when I first started going. And then, you know, just realizing these are just people. And the other thing to remember, these are also people, you alluded to it at the beginning of our little role play there. These are also people who want your vote. Mm-hmm. They want you to like them, right? And so you're asking something from them, but we're also wanting something from you, and that's to continue to support us in office.
Right. And like you said, too, you know, you've got bills that are going to come up that are banking or how do you grow soybeans or, you know, right, all of the other stuff. And it impacts economically or some of those things, but they're not life and death. And the bill that you're talking about is a life and death situation.
Absolutely.
You know,
it absolutely is, and has been life and death for far too many young people.
Yep.
Representative Willner, we have a question that came in that I think you can answer probably best of all of us who are on the panelist options. Amber wanted to know if there's any treatment for kids who have gone through the horrible situation. I assume she means conversion therapy, or is it only crisis treated?
There, I know a number of individuals who are in, you know, regular old supportive, client-centered, person-centered psychotherapy, helping them overcome the trauma of what they experienced when they were in this other form of treatment, not therapy, treatment. And it can take a very, very long time. There are absolutely explicitly LGBTQ affirming practices, LGBTQ affirming therapies, and I would look for a therapy group or an individual provider who is explicitly affirming to LGBTQ issues.
Thanks. I had a feeling you'd say that, folks. And if you have questions, obviously reach out to Megan or me, anybody who needs referrals. We have access to a whole list of those affirming providers. So
Wonderful. Thank you, Marcy. Thank you so much for that. And let me just say, there are stereotypes about LGBTQ folks. And some people, meet the stereotypes and some people don't. And so as far as Steve, you've talked about being a jock. There are many, many very athletic kids. And in fact, there are professional NFL players who have come out as openly gay, loud and proud about it. And so, we need to be careful about making assumptions about who kids are. We just need to be really careful about that as parents, as teachers, as, anyone, church leaders, anyone who interacts with young people. Let's give our kids a break, right, and not make assumptions. Let's let them tell us who they are, and let's create supportive environments, not just in therapy, but in every realm, so that kids can feel supported to be exactly who they are. And that's the best thing we can do as human beings. In addition to passing this law, there are a lot of just cultural things we can do to support young people.
Ms. Willner, this is Stephanie Benson, and I wanted to know, I'm enjoying your presentation, and I echo all of Steve's sentiments, and I wanted to know, do you have any strategies or information you could share with me if I just at the community level, I want to go just talk to the community. We a lot of time maybe set up booths, and maybe we're at a community center to create the awareness of suicide. And it's a little bit different when you talk about culture. When I go to the African American community, and when I, I can bring up the conversion therapy and let them know that, you love your child, whatever you love your child, and there should be no therapy that's gonna try to talk a child into being something that they feel that they're not on the inside. And so, are there any steps or anything that you could share with me that I could take at the grassroots level?
That's such a great question. And it's such a good lead in to something else that this is why I prefer dialogue to monologues, because I'll forget the things that I want to say unless we're just engaging in, conversation. There is a group of advocates, Band Conversion Therapy Kentucky, and Marcy has just posted information about that group. Individuals can reach out to them for resources and information. Stephanie, I'm guessing that if you went to a health fair or some kind of a community event and you reached out to them and asked for materials that you could have at your suicide prevention booth, I think they could fix you right up with some one-pagers, some information about that. And I will also say, Band Conversion Therapy Kentucky, just like this group, they are an organized group of advocates, some experienced, some brand new, and everything and everyone in between that. And I think being part of an advocacy community is so important because you learn from one another. I know for me, and I don't know if, I'm not going to speak for any other legislators, just for me, I prefer policies that are grassroots up rather than power structure down. And so I look for community groups to partner with. So working hand in hand with Band Conversion Therapy Kentucky, I might say to them, hey, I had a great conversation with one of my colleagues who didn't know anything about it and now is really interested in this issue. Can you follow up with some materials? Or they might say to me, we've been reaching out to so-and-so and, we're getting some nibbles and they have these questions, would you reach out as a colleague of theirs and have a conversation with them and try to answer their questions? So really this partnership with legislators and advocates. It's like, it's the best of all possible worlds, right? We're all working on a common goal because, as legislators, we're not blank slates. We have our own set of values. We have our own priorities. We have our own interests and the things that we're passionate about. And so when we're able to connect with an advocacy group whose interests and values and passions align with our own, that's just a beautiful thing. So anyway, I'm really happy to connect you with that group, and you will find them to be a really diverse and interesting set of folks, who very welcoming, very, very welcoming.
Okay, thank you.
I think I gave you a way longer answer than the question you asked. I get excited.
This
Thank
is
you
great.
so much,
So-
Representative Willner. I think we could listen to you all night. We're really appreciative that you joined us and helped us all learn a little more about advocacy.
It was great to be with you, and I look forward to the next time. And I hope I'll see some of you guys, if not in my office in person this time, at least in a virtual meeting. So thanks so much for having me.
Thank you.
Bye-bye.
She was great, Megan.
Yes, she was. All right, we are moving forward to some suicide facts and figures. So we're going to set a baseline for some language when talking about suicide. It's important to use safe messaging. So our advocates come from many different backgrounds, and some have lost a loved one to suicide. Some have had their own struggles or support someone that struggles, and some are professionally invested in this space through their work. And telling your story can save lives, but only if you share it safely. So sharing your story lets people know they are not alone and shows them recovery is possible. And if done safely, your story will encourage people at risk to seek help. So just a few things to remember. When you're sharing your story, you should be in a safe place in your recovery. You should avoid discussing details regarding method, as this may be triggering for those around you. Please avoid glorifying suicide by using terms like successful attempt. Instead, say completed suicide or death by suicide. And then avoid using the word commit. We often relate commit to crimes. So instead, say someone died by suicide or took their own life. And then always be sure to share mental health resources such as the National Suicide Prevention Lifeline or the Crisis Text Line, which Marcy, if you wouldn't mind putting those in the chat for everyone. I'll also have a slide at the end that shows these. And then last, practice. The more comfortable you are sharing your story and talking about suicide, the more we can break the stigma associated with mental health and suicide. In 2019, we lost 47,511 Americans to suicide. The CDC collects and shares data on the number of suicide deaths in the US each year, and it typically takes 2 years or so for this data to be published. So this is the most recent data available. Suicide remains the 10th leading cause of death in the United States. It is also the second leading cause of death for ages 10 to 34 and the fourth leading cause of death for ages 35 to 54. Over a third of those who die by suicide were over the age of 55. I always point out suicide takes more lives in the US than homicide, war, and natural disasters combined. It is estimated that for each suicide death, there are 25 attempts, which works out to be more than 1 million attempts per year. So this is part of AFSP's national fact sheet. You can find more of these at afsp.org/statistics, and they're being updated with the 2019 numbers. As you can see, Kentucky is in the middle third for suicide rates in the US. Locally in Kentucky, suicide is the 11th leading cause of death overall. For our youth and young adults ages 10 to 34, it is the second leading cause of death. And suicide is also the fourth leading cause of death for those ages 35 to 54 in Kentucky. So we wanted to give you a little information about suicide in the pandemic. Our preliminary data indicates that suicide rates in Kentucky have had a decrease since the start of the pandemic. So research related to natural disasters in the past shows that suicide rates often decrease during a crisis, but that there is a spike in suicides following the crisis. So we have specific concerns as we near the end of the pandemic, and especially on the year anniversary coming up. And we have specific concerns regarding the increase in firearm sales and alcohol sales since the start of the pandemic as well. But we are encouraged by the discussions regarding mental health and increased access to mental health services and community supports during the pandemic. For instance, over 16,000 mental health screenings happened in Kentucky in 2020, which is a 234% increase since 2019. National suicide prevention lifeline calls in 2020 have increased 8.3% over 2019, with the most significant increase in July, August, and September. Even with an increase in overall volume, Kentucky has been able to reduce the number of calls being answered out of state, meaning people that are getting connected with local call centers and local resources. And we just want to drive home the message that it's important to be proactive right now rather than reactive as we approach 1 year since the pandemic and shutdown started in the US. And it's important to promote messages that suicide is preventable. It's dangerous to say that suicide rates will increase because of the pandemic, because this kind of causation oversimplifies suicide and implies that it has a single cause, when we know that suicide is a convergence of biological, environmental, and other risk factors in one history. And if you want to learn more about that, please feel free to join me for a Talk Saves Lives presentation tomorrow night, if you're not sick of hearing me talk tonight. So now we're going to go a little bit into Advocacy 101. By advocating for issues you care about, like suicide prevention and mental health, you can make a difference. This provides you an opportunity to share your story and make connections with lawmakers at the federal and state level. We also provide a platform at AFSP, the Action Center, to email legislators directly, and I'll talk a little bit more about that later as well. So AFSP volunteer advocates make an impact in many different policy areas for suicide prevention and mental health. I just want to talk a little bit about the bills that together these three groups were able to pass last year. One was to help fund mental health first aid trainings, and the other made it the crisis line, the National Suicide Prevention Lifeline, and the crisis text lines on all student IDs across the state. So first, for those of you who may be new to advocacy, we want to address the question, where does legislation come from? It comes from legislators themselves based on their personal experiences, passions, and interests, as we just saw from Representative Willner. It comes from you as advocates and constituents, and we'll talk a little bit about a bill that we want to try to introduce from this Capitol Week. It comes from organizations like AFSP that work directly with legislators and other leading mental health organizations around the country to write new policy and provide resources to support future legislation. Once a legislator has an idea for a bill, they will draft language and introduce it. Once introduced, the legislation is assigned to the relevant committee within the House of Origin. This is either the House or the Senate. For example, if we work with a senator to introduce a bill to have all teachers trained in suicide prevention, that bill's House of Origin is the Senate, and the bill will be sent to the Senate Education Committee. The committee then has the opportunity to review, edit, and vote to approve the bill language before sending it to the floor for a full vote. If the bill is voted on favorably, it will go to the other house. So our teacher training bill, for example, if approved by the Senate Education Committee, will go on to a vote by the full Senate. And only if the Senate votes favorably on it would it be moved to the House and go through the same committee review and floor voting process. Only when a bill has been voted on favorably in both houses can it go to the governor to be signed into law. And then once received by the governor's office, the governor typically has a set number of days to act on the bill by signing it or by vetoing all or parts of the bill and sending it back to the House and Senate for additional recommendations. In many states, the governor can also choose not to sign or veto the bill and can instead allow the bill to become law without his signature. When speaking to a legislator or their staff, it's important to be polite and thank them for their time. Like Representative Willner said, don't come at this in an attacking way and leave your personal politics out of this, as suicide is a nonpartisan issue. It's important to practice because you might only have a brief time with them. So practice your elevator speech about why suicide prevention is important to you. And then in your communication with the legislative office, if you don't know the answer, that's okay. Just say, I do not know the answer to that right now, but I'll be happy to find out and to follow up with you as soon as I have the answer. This is a really excellent excuse to maintain communication with the office. So please don't be embarrassed if you don't know something. And also, please do not make up a statistic or a fact that you aren't sure of. So there are lots of ways to build relationships and stay connected with your lawmakers throughout the year. You can email and call them through the AFSP Action Center. You can tag them in social media posts. You can meet with them or their staff virtually or over the phone or by video, and sign up for newsletters so you know when they are hosting town halls and events in your area. Many town halls and legislative meetings are now being held virtually, and so you have a lot more opportunities to become engaged in the legislative process. As you begin your advocacy journey, it's important to know what resources you have at your disposal. So state legislative websites offer several resources to advocates. You'll be able to identify your legislator and their contact information. You can see what laws are currently enacted and search for legislation that has been introduced in the current legislative session. And advocates can also sign up for newsletters and find out what relevant events and advocacy opportunities may be coming up. So if you're interested in learning more about the specific policy areas that AFSP works on at both the federal and state level, here are several resources that are available to you. The Public Policy Office has hosted and shared policy-specific webinars, film sample meeting videos, which we may still have time to watch at the end of this. Otherwise, I'll email it out to you guys afterwards. And they create issue briefs for each policy area that help explain AFSP's policy position and show what laws are in place in each state. So now we have a brief message from Lieutenant Governor Coleman, who these groups have built a really strong relationship with over the last year, and she has become a huge ally for suicide prevention in Kentucky.
Team Kentucky. In 2020, on average, one person died by suicide every 11 hours across the Commonwealth. One life lost to suicide is one too many. That is why I come to you with a call to action. Today, I ask every Kentucky family to make a plan to get involved with Kentucky Suicide Prevention Week on the Hill on Zoom, beginning February 1st through February 5th. Each year, State Capitol Day events take place across the nation to bring advocates like you together to share your story and to urge that suicide prevention be made a priority in Kentucky. With this year's program being virtual, it brings more opportunity for Kentuckians like you to share your voice and your story with Kentucky state officials. Just sharing why suicide prevention is important to you makes you a powerful advocate. By starting the conversation, providing support, and directing help where it's needed, we can prevent suicide and save lives. Thank you for helping us fight suicide across the Commonwealth. Team Kentucky.
All right, so now we're going to get into our policy priorities. We've already talked pretty extensively about the bills being introduced to ban conversion therapy. So it prohibits mental health professionals from engaging in sexual orientation and gender identity change efforts with minors or vulnerable adults. So we have you've already received a lot of the background information on conversion therapy, but it's based on the belief that homosexuality is a mental illness that needs to be cured. And this belief has been found to be scientifically invalid in the mental health professional community.
Megan, do you know where this bill is at this point in time? Has it been introduced or?
It has been introduced and is awaiting committee assignment, I believe. Marcy?
That's still correct until tomorrow morning.
Okay.
Hopefully we get into committee tomorrow.
Hopefully.
Everyone make a call.
Do you
Everyone.
know what committee has it been assigned to?
It is not. It's still sitting in the committee on committees. That's what we're
Okay.
trying to get it assigned. We know it will pass in several different committees. So,
Right.
Thank you. So we talked a lot about this, but I did want to go over some of the statistics that Representative Willner referred to. So lesbian, gay, and bisexual youth are approximately 3 times more likely to contemplate suicide and about 5 times as likely to attempt suicide compared to their heterosexual peers. And transgender individuals are 8 to 10 times more likely to attempt suicide than cisgender peers. There is a 42% increase in suicide attempts for LGBTQ youth who are subjected to conversion therapy. So this is a bill that we are in strong support of, all 3 groups today. Our second priority is mental health parity. There are 2 bills currently being introduced in the House for mental health parity and wellness exams. HB 50 will strengthen existing state law by requiring insurers, including individual health benefit plans and employer organized associations, to comply with the federal parity law, which I'll explain a little bit about the federal parity law in a minute. And it requires parity coverage for non-quantitative treatment limitations and requires insurers to submit an annual report to the insurance commissioner that demonstrates parity compliance. HB 77 requires health insurance policies that provide coverage for both medical and surgical benefits and mental health or substance use disorder benefits to provide coverage for an annual mental health wellness exam of at least 45 minutes by a mental health professional. So this bill would basically, the same way you're able to go to your doctor and get an annual physical, you'd be able to go and get an annual mental health exam.
and House Bill 50 just got put into banking and insurance for Wednesday morning.
Beautiful. So this is the perfect time to talk about House Bill 50. So mental health parity, if you're not familiar with this term, assessment and treatment for mental health conditions can save lives, but only if individuals at risk can afford to obtain that care. So the federal parity law passed in 2008 requires that insurance coverage for behavioral health services be no more restrictive than coverage for other medical conditions. But states must remove barriers to care by ensuring that these parity laws are uniformly enforced across the state, and by plan types that require insurers to regularly collect data and report on their compliance with federal and state laws. So insurance plans are often not in compliance with some of the more complex components of parity laws and continue to apply managed care practices in ways that are more restrictive for mental health and substance use disorder treatment than for other medical treatment. So the NQTLs, or non-quantitative treatment limitations, are defined as any limitation in access to care that is not expressed numerically. So this include prior authorization or fail first requirements, medical necessity criteria, network provider standards, and geographic restrictions. So we strongly urge the enforcement of parity laws and making this happen in Kentucky, because it definitely is not always enforced by our insurance companies.
Who's sponsoring the bill? Do you know?
I do not have that information.
Representative Mosier?
Yes.
Is the primary?
Thank you, Marcy.
I've got it pulled up. You're good.
Thank you. I'm like, I can't exit out of this. Okay. There has been a new development with the mental health parity laws with the COVID-19 relief package. So it requires health insurers to analyze their plan's compliance with parity laws specifically regarding these NQTLs and to make those available to the U.S. Department of Labor or a state insurance regulator upon request. The U.S. Department of Labor can request a parity analysis whenever it receives a complaint, and plan members and Congress are to be notified of non-compliance. But state legislation is still needed to ensure annual proactive reporting. So our third priority is funding for our crisis lines. So the National Suicide Prevention Lifeline, which you see shared quite frequently, is a national network of state and local crisis centers linked through a 24/7 toll-free number, which is currently 1-800-273-8255. It connects callers throughout the U.S. to immediate crisis care. Callers are connected with a call center in their own state, and this is really important for people to get local resources and have somebody in their own region that understands their culture and understands the resources that are available. So it's very critical that we're funding the local centers so that more and more calls can be answered in a person's home state. If a call is not answered within a certain amount of time, calls are rerouted to one of the 9 backup centers in our network, which can be in or out of state for the caller. Statewide crisis lines help to ensure that gaps in local services and delivery areas are served and that calls are answered 24/7 by individuals trained to handle suicide risk and other mental health crises. Although the Lifeline's proven itself to be an essential, necessary component of suicide prevention and mental health care system, the network of crisis centers consistently faces 2 main interconnected barriers to its effectiveness and success. And these barriers are always insufficient funding and their capacity to respond to increasing call volume. So while the Lifeline is a national program, federal funding goes towards managing the call routing, best practice standards, public messaging, and technical assistance. It's up to the local centers to find funding from the state and from local contributors to operate and grow their centers in order to meet the call volume. So it's critical for state governments to provide funding to crisis call centers within the Lifeline network to make sure that these calls are being answered in state. In October 2020, the National Suicide Hotline Designation Act became law, and this is huge because it designates 988 as the future 3-digit code for the National Suicide Prevention Lifeline. So just like you're able to call 911 if you're in a physical emergency, you'll be able to dial 988 if you're in a mental health emergency. This requires full implementation and access of 988 by July of 2022. And it empowers states to enact laws allowing 988 to be funded the same way as 911 through monthly customer service fees. And we have model language for any senator or representative that's interested in introducing this historic legislature that would go such a long way in putting mental health on the same pedestal of importance as physical health. Timely access to mental health and crisis service can save lives. So we urge every state to pass legislation enacting a customer service fee for 988. This will ensure that call centers have the capacity to answer increased call volume because it's going to be so much easier for people to get a hold of the crisis line by just dialing that 3-digit code. This will ensure that callers can be connected 24/7 with a center in their own state, which, as we discussed, is really important. And call centers will be equipped with resources to connect callers with wraparound services and care. So it's not just a one-time call, but they're able to get them follow-up services. So before we move on, I do want people to take a picture of this or save these numbers in your phone, because until 988 rolls out, the National Suicide Prevention Lifeline will remain a 10-digit dialing code, 800-273-8255. I cannot wait for it to be 988. So I hope that in your talks with your representatives and senators that we can make this funding, which is really critical for suicide prevention in Kentucky. I hope that we can get that through this year or next.
And Rebecca Houston wants to know, do we just focus on one bill when we speak with legislators or all of the bills?
I am actually about to answer that in just a moment, going through what to expect from your meetings. So I will get to that, but basically you can choose the priority you are most passionate about and most connected to talk about. If you have time to talk about the other priorities, that's great. You'll be giving them, all of them should have received our public policy issue brief that was sent out last week. So they are familiar with everything we're advocating for. So I would pick the best starting place is pick the area that you feel most strongly about. So action items, I just want to give you a few ways that you can take action this week in support of policy priorities that we reviewed today. So every advocate has received an email prompting you to visit the AFSP Action Center to email your legislators in support of the policies discussed today. If you're looking to take additional action, we can work with you to schedule a phone meeting with the legislative office. I shared with those of you who expressed interest in meeting with your representative or senator a personal vignette that you can fill out to send them or leave with them. I think that's important because it helps let the legislator know why suicide is personal to you and why suicide prevention is everybody's responsibility. And at any time, you can promote suicide prevention and positive mental health on social media. You can tag your legislators, you can tag any of these groups, and we encourage you to use the hashtag this week, hashtag Kentucky Stop Suicide. So one really easy way that you can take action is by visiting afsp.org/action center. It's all set up for this week. You can go ahead and send an email to your legislators that goes through the issues that we've discussed today and why they're important. It does give you the option to personalize these emails, and I highly recommend doing that. Again, we want to make a personal connection with our elected officials. And don't forget that you can also share this link on social media so that people around the country can get connected with their local officials to help pass important suicide prevention legislation. So another thing you can do is call. For those interested in meeting with the legislator or their staff over the phone or on Zoom, there are a few things to keep in mind. Practice your elevator speech, as we discussed earlier. Make sure that you're comfortable sharing your story. One easy way to practice is by filling out that vignette that I sent you. And that can be shared before or after a meeting, whatever you feel works best for you. And then typically legislative meetings are about 10 to 15 minutes. So just maybe start the meeting out asking how long you have, and that can help guide how many of the issues you talk about. And so we encourage you to select one area from the issue brief that you're most passionate about and talk about that. And then if you have time, you can cover the other issues, but don't worry if you can't get to all three. And after your meeting with the legislative office, it's important to follow up and offer yourself, offer AFSP, KSPG, the Prevention Consortium, offer us as resources and help us connect. Definitely send a personalized thank you note, a copy of your vignette if you didn't send it before the meeting. It will help them put a name and a face to your story. So real quick, I'm going to show you an example of a meeting with a local councilman.
Want to make a difference for suicide prevention and mental health? Want to get the attention of your public officials? Want to save lives through advocacy? Here's how. Public officials listen to their constituents, and that's you. Advocating for suicide prevention is easier than you think. So get ready to take action, advocate, and save lives.
When advocating at the state and local level, and sometimes at the federal level too, you may have the opportunity to meet with your public officials. Today, we're meeting with Council Member David Grasso.
Get organized. Have the materials you plan to share ready. You must be on time to your meeting. Early is better. Decide who is leading the meeting before you get there. Practice sharing your story out loud. You might want to do this in front of a mirror or with a trusted friend or family member. Keep your story to 2 to 3 sentences, 30 seconds or less. Decide what you are asking for and how you are going to ask for it. Collect yourself before the meeting. Calm those butterflies, and now you're ready to advocate. Introduce yourself. Thank the council member for meeting with your group.
Council Member, it's great to see you again. Taylor and I are here today representing the American Foundation for Suicide Prevention for our first ever Advocacy Day here in the district. So thank you so much for taking the time to speak with us.
Well, it's my pleasure.
Ask how much time for this visit.
How much time do we have today?
Thank the council member for previous support, if applicable.
It just means so much to me, both personally and professionally, that you introduced the Youth Suicide Prevention and School Climate Survey Act back in 2016 to require educator training in school policies and suicide prevention. Thank you so much for your leadership, for being a true champion on this issue.
Share your personal story. Ask other group members to briefly share their stories.
I've been with the foundation for about 10 years now, since losing my brother to suicide. He was in high school when he died, so it just means so much to me.
So I'm also a field advocate, and I have a number of family and friends who struggle with their mental health and with finding the necessary resources.
Share the AFSP national and state fact sheets and underscore that suicide is preventable. State there are steps the council member can take to support prevention efforts and share the talking points and legislative needs.
As you can see here, suicide is the 15th leading cause of death in Washington, D.C., the 10th leading cause in the country, but we know it is preventable.
Which brings us to our 2 asks of you today. The first bill would require regular training for health professionals in suicide assessment, treatment, and management.
And the second bill we'd like you to support would address suicide prevention on college and university campuses. We've also included some language for a resolution making September Suicide Prevention Month, if you'd be interested in introducing that this year.
That's great. I really appreciate the advocacy, and obviously I'll look closely at your materials. In fact, I'll be happy to put you in touch with my staff as well to make sure that they have your contact information and you have theirs to work on these bills as well as perhaps introduce the resolution. So thank you.
Request to take a picture with a council member if time. Give folder to the council member, shake hands, and be sure to say thank you for their time. Write down notes from your meeting so you can report back to the AFSP Public Policy Office. So that wasn't so hard, was it? Your AFSP advocacy does make a difference, whether it's on the local, state, or federal level. Start planning your meetings with your public officials now. The AFSP Public Policy Office is here to help you along the way.
All right, so hopefully that gave you a better idea of what a meeting can look like. Obviously, that was an in-person meeting, so it will be a little different this year, but hopefully it will help you for future years of advocating. For those of you who are interested in scheduling these meetings, just a few final reminders. The name and contact information of the legislative office you're assigned to meet with were in there. It was your state representative and your state senator. You can also find this information on the Kentucky Legislature website that I shared earlier. I also shared a sample meeting request and a link to a legislative meeting feedback form, so you can share a little more about what took place during your meeting. Also wanted to quickly share a few upcoming events. We will have a Talk Saves Lives presentation tomorrow that all of your elected officials have been invited to, as well as their staff and all of you. So if you want to learn more about suicide prevention, this is a really great presentation. It takes about 45 minutes. Mental Health of America has a mental health first aid training coming up. And then the Suicide Prevention Consortium of Kentucky's meetings are all public. Their upcoming meeting is February 17th, and they're usually the third Wednesday of each month. Also not on here, there are some upcoming QPR presentations from the Kentucky Suicide Prevention Group that will be coming up. They work with K-SPAN to hold these presentations. So you can reach out to any of us and we'll help get you connected with any of these upcoming events. So thank you so much. Here's some ways that you can get connected with the 3 groups on social media. And now, if anybody has any questions, we're all happy to answer them right now.
Beautiful job, Megan. Just beautiful.
Thank you, everyone, for joining us. If you have any questions, if you are still a little nervous about having one of these meetings, any of the people on this call would be happy to attend with you. There's also some crossover. Some of you have the same senator or same representative. So if you want to find out if somebody else attending this event has your same senator or representative, so you can partner up with them, just feel free to reach out and I'll get you in contact with whoever that is. So if there are no other questions, everybody have a really great night and good luck with your meetings this week. And let us know how we can help and support you, because together we can save lives and bring hope to those affected by suicide.